name's Glenda Farmer and I'm going to talk to you today about setting up a comprehensive, occupationally relevant immunisation program for your workplace. Now, if somebody just said that to me, I'd think, wow, what a good idea. Someone should do that. Not me. But it's not that bad. We just finished one in our own dental practice and I thought I'd help other people work out how to do theirs as well. Because immunisation is sort of one of those things that we can forget about or become a bit complacent about. Yet immunisation is one of the most important parts of your infection control program in your dental practice. Now, I think we forget about immunisation because for most of us, our experience was really childhood vaccinations, and the Australian government has been so successful in minimalising or virtually eliminating a lot of these infections, so we actually don't experience them. But it's sort of timely to be reminded about what could happen. So I want to start off by just telling you two little stories. One was something reported in 2001 in the literature, and it was about a woman who was a 60-year-old who acquired hepatitis B. Now, hepatitis B is a notifiable disease, so when this happens, the pathology lab and the doctors both tell a government department who does surveillance on this, and they try and work out where these infectious diseases are coming from and how to prevent the spread, because it's very costly business both to the individual and to the government. So with this 60-year-old woman, the person investigating her was very vigilant. They questioned her and they believed her when she said she had no behaviours that would lead them to think that she was in a risk category. So they looked into it further and they actually identified the source of her hepatitis B. And it was another patient who'd been seen in an oral surgery practice on the same day, and there were 3 or 4 patients in between these two particular individuals. So we had the source patient, 3 or 4 patients, and then this poor woman who contracted hepatitis B from the source. And they were never able to identify how the transfer happened. But what they did find, which was really interesting, was that there was none of the patients seen in between, and none of the staff contracted hepatitis B. And they put that down to the fact that everyone else was immunised. So it just reminds you of the importance of immunisation. The other thing was in 2008, a traveller from Switzerland entered a Texas hospital and spread measles, and 14 adults contracted measles. 4 of them had to be hospitalised. And the result of this was a big program. They had to test a lot of people, they had to treat a lot of people. It cost the hospital $750,000 in the end. And the thing they found that really upset the government or surprised them was over 25% of individuals that they tested, staff members they tested, were not immunised at all for measles. So that was a bit of a scare. And in 1998 in the UK, there was a bit of a scare which caused some parents to stop giving their children measles, mumps, rubella vaccination, and what happened as a consequence of this were hundreds of children were hospitalised and 4 died. So it is very, very important. So what we're going to go through is an immunisation program, and we're going to follow what's suggested by the NHMRC in the document that's been released called the Australian Guidelines for Prevention and Control of Infection in Healthcare. So what they suggest is doing 4 things. The first one is to have an immunisation policy, which is pretty obvious. The second one is to have some system of managing staff immunisation records. The third thing they ask you to do is to have some information that's relevant to staff on vaccine preventable diseases. And the 4th thing they suggest is having some way to manage staff refusals. So if a staff member refuses to be vaccinated, how do we manage that, and how do we manage vulnerable patients? So we're going to step through how we did this process using the Smart Dentist site. But if you aren't a subscriber to Smart Dentist, you can take this information and adapt it to your own situation and the way you'd like to do it. So let's look at the Smart Dentist way of doing this. So here we have the Smart Dentist page, and we need to do a bit of housekeeping first. So we need to go in and add a staff member, and in here I've put 2 people already, myself and John Smith, just to show you how I do it. And Jackson, and let's make her a receptionist. We'll just go save. Now the Smart Dentist site uses this information to determine whether people have had the appropriate immunisations or not. So it is important what you select as the staff role. The other thing that you should do at this stage is make sure you have a staff password. It's a different staff password to your own password. And what this allows is for staff to look around the site without having access to the content of forms that people have filled in. So you know that the information you've put in there remains confidential. And what will happen at the end is we will have this complete immunisation record. So on this page we have links to the policies and procedures, we can pick up forms, we've got staff training, or we can go out of this site and find out what the Australasian Immunisation Handbook has. This page also will list who's in charge, and there's a review date as well. So let's go on and look at the policy that we have for our practice on immunisation. And you can see here there's no date, so this hasn't been approved by a practice. In here we've got the policies and procedures of the practice, and basically what's written in here is what's legally required. Then we've got a more customised area with the practicalities of what will go on, and there's an opportunity for you to put a name in there and to change the information to customise it for your practice situation. Down here we have a little grid that shows the management of refusal or non-immunity of staff and the vulnerable patients. So what are we doing to work out the risk and avoid it being an issue? And we also have exclusion periods for healthcare workers with acute infections. So you can just have a look through and see what the usual exclusion time is. Of course, for a dental practice, it's most likely that the person who will be managing healthcare workers with acute infections is their own general practitioner, but it just gives you an idea of the sorts of things that they will set forth. So what we need to do is go into this area, select a name, and we'll select myself, and this will be the person who's down as being responsible for implementing this policy. So we'll always know who was in charge. There's additional information that you may want to put in there. We're happy with that. We go submit. Let's go back and look again and see what this page shows. It shows the date of today in there, so it shows when it's last updated. If you go into our complete immunisation records, you can see if we refresh this. So we can now see the refreshed page for complete immunisation records, and you can see how automatically the name has been transferred in there, so you can just go to the one place to find the information, when our policy was last reviewed and when it's scheduled for another review. So what we've covered in a really quick, easy manner is steps 1 and 4 of the NH and MRC requirements. We have an immunisation policy, and we have details about how we manage vaccine refusal. So we've now got to find out who's got vaccinated against what, and we can get into the staff immunisation and allergy forms by selecting here. And this is the form setting up what we want our staff to tell us. And you can see here we've got each of the staff members' names, so we can just select one of them, click through and tell us what's going on, pick a year for this, and those are not applicable, and I have no allergies. So what we've found worked best in our practice is to use the printable form. So if I click on here, it gives me a PDF that you can hand to the staff members with all of this information on it. And below here, we have an information sheet with information on relevant preventable diseases. Again, we've made a printable version so you can easily hand that out at a meeting and people don't have to read it on the website. But you can see the types of information that we've got there. It's really relevant, and one of the things I've put in there is the Australian immunisation schedule, so people have some idea when they are likely to have been immunised. So we just press the submit button, and that's added to the complete form list. We go back to completed immunisation records, and there I am here. And if I click on this, this will open up the form with all those details. So you can see the date of influenza. So next year when that needs to be changed, this just clicked and you can open up. But if you entered this area with the staff login, this would not be a clickable thing, so you wouldn't be able to tell what's going on. And you can see it counts up on the list. Number of staff who've completed the immunisation form. And it's 1 out of 3 because I'm the only person and I've clicked everything so it satisfies the requirement. Now there's 2 more things you can do to contribute to your staff and everybody being up to date with immunisation. One is that people can look at the staff training on immunisation, and this is just a simple sheet of information, gives you some greater idea of why it's important to be immunised, and once people have read through it, they can just add themselves to the list, signifying that they have added that to their training schedule, and you can see it's up there. And last but not least, it's important to have a staff meeting to discuss these things. So this video can be part of your staff meeting, but make sure you tick the immunisation and you can write some details in there, and we've got business completed, and we just press submit. And having a record of documented discussions with your staff about such important things is part of the new occupational health and safety requirements. And you can see here it's been added on to the completed immunisation record page because you've ticked that link saying the topic was immunisation. So that gets added in there. The staff training gets added there, and the same 1 out of 3 of the members of this demonstration site have done that, so all your information is there. See, wasn't that bad, didn't hurt much. It's actually not difficult, and now we've got a whole process set up, and we can look at this again next year, particularly in the flu season. We can update people's flu shots and make sure it's all current. And we can see that our policy remains current because we've got a date in there to remind us of when we should review it.